Have you noticed tingling, burning, numbness, or sharp pain in your feet and legs that just won't go away? What if I told you that a few simple movements done daily could help wake up your nerves, improve circulation, and reduce that discomfort naturally? And the best part? You don't need a gym, expensive equipment, or complicated routines. Today, I'm going to show you the only 6 exercises you need to help relieve neuropathy in your feet and legs. Neuropathy can feel frustrating and exhausting. Some people describe it as pins and needles. Others say it feels like walking on cotton, hot sand, or even electric shocks shooting through the feet. And for many older adults, it slowly steals confidence in walking, balance, and daily comfort. But here's something important that many people don't realize. Movement is one of the most powerful natural tools for supporting nerve health. When nerves don't get enough blood flow, stimulation, and muscle support, symptoms can become worse over time. Sitting too much can make the numbness and stiffness stronger. But gentle exercises can help improve circulation, activate muscles, and encourage healthier nerve function. Now, before we begin, I want to say something very important. These exercises are gentle and designed for most people, but everyone's body is different. If you have severe pain, advanced diabetes complications, balance issues, recent injuries, or medical concerns, talk to your healthcare provider before starting. This video is for educational purposes only and not medical advice. Alright, let's get started with the first exercise, and honestly, this one looks almost too simple to work. But don't underestimate it. The first exercise is ankle pumps. You can do this sitting in a chair or lying down. Simply point your toes away from you, then slowly pull them back toward your body. That's it. Repeat this movement slowly and smoothly for about 30 seconds to 1 minute. It may not look impressive, but ankle pumps help increase blood circulation in the lower legs and feet. And circulation matters because nerves rely heavily on oxygen and nutrients delivered through healthy blood flow. Think about it like watering a garden. If the hose barely works, the plants struggle. Your nerves are similar. Better circulation can help support the environment your nerves need to function properly. Many people with neuropathy notice their feet feel colder than usual. Others say symptoms get worse at night after sitting all day. That's often because blood flow slows down and muscles stay inactive. These small ankle movements help get things moving again. And here's the key: don't rush. Slow, controlled movement is more effective than fast motion. You want the muscles and nerves to gently activate, not strain. If you're following along right now, take a moment and notice how your feet feel already. Sometimes even 1 minute of movement can create warmth and awareness in the legs. Now let's move into exercise number 2, and this one is fantastic for balance and nerve stimulation. Toe raises and heel raises. While holding onto a chair or countertop for support, slowly lift your heels so you're standing on your toes. Hold for a second, then slowly lower back down. After that, lift the front of your feet while keeping your heels on the floor. This movement activates the muscles in the calves, ankles, and feet, areas that often weaken when neuropathy develops. A lot of people don't realize this, but weak muscles can actually make neuropathy symptoms feel worse. When muscles lose strength, balance becomes unstable, walking changes, and pressure on the feet increases. Heel raises help strengthen the back of the lower leg, while toe raises target the front muscles that help lift the foot when walking. This is especially important because some people with neuropathy develop something called foot drop, where lifting the front of the foot becomes harder. Even if your symptoms are mild, building strength early can help protect mobility later on. And don't worry if your movement feels shaky at first. That's completely normal. Start with 5 to 10 repetitions and slowly build over time. By the way, if you're finding this information helpful so far, make sure to subscribe to Dr. Waterling Hub for more simple health tips designed to help you stay active, healthy, and independent as you age. Now let's continue with exercise number 3, and this one is surprisingly powerful for people dealing with numbness. Toe curls. Sit comfortably and place your feet flat on the floor. Now slowly curl your toes downward like you're trying to grab a towel with them. Hold for a few seconds, then release. This small movement helps strengthen tiny muscles inside the feet that often become weak or inactive with neuropathy. Here's why this matters. Your feet contain thousands of nerve endings constantly communicating with your brain, but when neuropathy develops, that communication becomes weaker or distorted. Gentle stimulation exercises like toe curls help wake up those pathways. Some people even place a small towel under their feet and try to scrunch it toward themselves using only their toes. It may sound simple, but it can be incredibly effective over time. And remember, improvement with neuropathy usually happens gradually. Many people quit too soon because they expect overnight results. But nerves heal slowly. Consistency is where the magic happens. Imagine brushing your teeth once and expecting perfect dental health forever. It doesn't work that way. Daily habits matter. The same is true for nerve-supporting exercises. Now, before we move to the next exercise, let me tell you something encouraging. Even small improvements matter. Maybe your feet burn less at night. Maybe walking feels a little steadier. Maybe you sleep better because the tingling decreases. Those small wins add up over time. Alright, exercise number 4 is one of the best for improving flexibility and reducing stiffness. Calf stretches. Stand facing a wall and place your hands against it. Step 1 foot back while keeping that heel flat on the floor. Slowly lean forward until you feel a stretch in the back of the calf. Hold for about 20 to 30 seconds, then switch sides. Many people with neuropathy also deal with tight calf muscles and stiff ankles. When these areas become tight, walking becomes harder and circulation may decrease. Stretching helps improve mobility and reduces tension in the lower legs. And there's another benefit people often overlook. Stretching can help calm the nervous system. Stress and tension can actually make nerve symptoms feel more intense. That's why some people notice their neuropathy feels worse during stressful times or poor sleep. When you stretch slowly and breathe deeply, your body shifts into a more relaxed state. This may help reduce overall discomfort. And here's a helpful tip: never bounce during stretches. Gentle and steady is the goal. Now let's move into exercise number 5, one of the most important exercises for preventing falls. Seated marching. Sit upright in a sturdy chair. Slowly lift one knee toward your chest, lower it, then lift the other knee. This exercise improves hip strength, circulation, coordination, and balance support. A lot of neuropathy sufferers focus only on the feet, but your hips and legs play a major role in stability. Weak hips can make balance problems worse, increasing the risk of falls. And falls are serious, especially for older adults. What makes seated marching great is that it's safe, low impact, and accessible for many people, even beginners. You can start slowly for 30 seconds and gradually work up to a few minutes. And while you're doing it, pay attention to posture. Sitting tall helps engage your core muscles and improves overall body control. Now there's one more exercise left, and honestly, this might be the most relaxing one of all. Exercise number 6, foot rolling massage. Take a tennis ball, frozen water bottle, or massage ball and place it under your foot. Slowly roll your foot back and forth over it. This exercise combines gentle stimulation, massage, and circulation support all at once. For many people with neuropathy, the bottoms of the feet feel tight, sensitive, numb, or painful. Rolling massage helps stimulate nerves and relax the muscles and connective tissues underneath the foot. If your feet feel especially inflamed or hot, a frozen water bottle can feel incredibly soothing. And here's something fascinating. Your feet contain sensory receptors that constantly send information to your brain about balance and movement. Gentle stimulation may help keep those communication pathways active. Now, I want to pause for a second and talk about something extremely important. Exercises help, but daily habits matter too. If you smoke, blood circulation to the nerves can worsen. If blood sugar stays uncontrolled, nerve damage may progress faster. If you rarely move throughout the day, stiffness and weakness can increase. That's why combining these exercises with healthy habits creates the best results. Try to walk regularly if you're able, drink enough water, prioritize sleep, wear supportive footwear, and most importantly, stay consistent. Neuropathy recovery or improvement is often more about small daily actions than dramatic treatments. And please don't lose hope if progress feels slow. Nerves can take time to respond. Some people notice changes within weeks. Others may need months of consistency before major improvements appear. The goal is progress, not perfection. And something else worth mentioning is that movement also helps mentally and emotionally. Chronic discomfort can make people anxious, frustrated, or discouraged. Gentle exercise gives you a sense of control again. You're reminding your body that it can still move, adapt, and improve. Now imagine this for a moment. What if 6 months from now your feet feel steadier, you walk with more confidence, you sleep better at night, and those burning sensations become less frequent? That future may begin with just a few minutes of movement every single day. Before we finish, let's quickly review the 6 exercises again. Ankle pumps to improve circulation, toe and heel raises for strength and balance, toe curls to activate foot muscles and nerves, calf stretches for flexibility and mobility, seated marching for coordination and stability, and foot rolling massage for stimulation and relaxation. Simple movements, no fancy equipment, no expensive programs, just consistent daily care for your feet and legs. And remember, if symptoms suddenly worsen, if you develop open sores, severe weakness, or major balance problems, make sure to seek medical attention promptly. If you enjoyed this video and learned something valuable today, make sure to subscribe to Dr. Waterling Hub and turn on notifications so you never miss our latest health videos designed to help you live stronger, healthier, and longer. Your body has an amazing ability to adapt when you give it the right support. Start small, stay consistent, and give your nerves the movement they've been waiting for. Thanks for watching, and I'll see you in the next video.